Reports like this one are released every month by the Tennessee Department of Health and outline all disciplinary action taken by health-related boards regulating medical professionals in the state.
Medical doctors regulate medical doctors, nurses regulate nurses, and so on. That authority is given to them by the General Assembly.
David Silvis is the Chief Deputy General Counsel for the Tennessee Department of Health. He explains how these investigations come to be.
We're generally a complaint-driven system. Generally, we don't look into doctors or nurses absent a complaint from the public, which can be made by anybody.
When an investigation concludes and wrongful doing is found, the findings are then made public. These reports show a variety of violations, from expired licenses to wrongful distribution of a controlled substance to unauthorized use or removal of narcotic supplies or equipment.
By and large, thankfully, it's always been true that the vast majority of our doctors and nurses are have never done anything that would cause any problems.
For those that do, there are consequences outlined by the board that range from fines to suspension and sometimes more.
We can move very quickly on our own end if we believe there is an imminent risk of harm to an individual or to the public as a whole, and we can take someone's license away.
But the board is not required by law to inform authorities of criminal activity.
Oftentimes in the overprescribing realm, we sort of are encountering the same actors as maybe the DEA or Health and Human Services. We're certainly not free to share information with them freely because there are some confidentialities, but we will oftentimes receive subpoenas from those law enforcement agencies for information.
Silvis says that doesn't happen as often as it may have in the past.
There has been a shift probably in the last 8 to 10 years in prescribing habits across the state. And I think some of that's probably a function of tighter regulation and also a better awareness on the part of prescribers, doctors, nurses, and physician assistants.
Even still, Silva stresses if you believe unethical behavior is happening, report it. Alex Dennis, News 2.